I wanted to just briefly talk about a trial that's currently active in Western Australia, which is looking at trying to provide a more systematic involvement of primary care in the follow-up of men for prostate cancer. It's called the ProCare Trial. It involves a large number of investigators, both in Western Australia and Victoria, and coordinated by Juanita, who's in the audience here this evening. So a little bit of background, as we've heard, prostate cancer is becoming increasingly common. Back in 2007, which is the most recent figures, just over 19,000 men were diagnosed with it. Fortunately, it has very good survival rates, up to 90% of 5-year survival if men diagnosed before the age of 75, which means there's a growing number of prostate cancer survivors in the community. We know from Beach data that GPs are already involved in follow-up, but that there are significant unmet needs amongst prostate cancer survivors, both significant psychological and psychosexual needs, some of which are being discussed this evening. There are potential problems with our current models of care for a variety of reasons: communication between hospital and general practice, as I said, unmet psychological and physical and psychosexual issues, and sometimes poorly coordinated care. And so the ProCare trial is trying to solve some of those issues by looking at a new model of shared care involving urologists, radiation oncologists, and general practice. And there are a number of components to this model of care. First is trying to solve some of the problems of communication through a structured, tailored care plan that provides information both for the patient and for the GP, which summarises their disease, the adverse effects of treatment they have specifically suffered, their treatment team, evidence-based guidance on some of the issues that we've heard tonight about detecting recurrence and managing common urinary and bowel symptoms, and information about locally available services. We're setting this up in a bit like a model of chronic disease care, so there's a register and recall system so that the men are reminded when their next visit is, with whom, and the GP is also sent a reminder about the structure of their next visit and that their patient is coming to see them. We heard a little bit earlier about the distress thermometer, and that's another component of this intervention, so that men will be sent a distress thermometer prior to their visit in general practice as a way of, again, screening for distress and identifying some of the needs that they particularly want to discuss at their appointment. And then men are provided with a number of information resources, including some of those both from the Cancer Council and from PCFA. And so the idea about the model is that we replace some of the traditional hospital visits with general practice visits. And so the current model of follow-up in the first year after treatment is that they're seen at 6 weeks, 3 months, 6 months, 9 months, and 12 months. And we're replacing the 6-month and 9-month visits in general practice, where they will, as I said, complete their distress thermometer. And there's also an early visit so that they reconnect with the GP shortly after treatment to see how they're getting on. And so that's the follow-up schedule. The trial is really just underway, and it's a randomised controlled trial comparing usual care with this new model of shared care. And we're aiming to recruit quite a large number of men, 188 men, and following them up for 12 months. And we're really interested in some of the important psychosocial outcomes, so anxiety and depression, prostate cancer, specific quality of life, their satisfaction with the two different models of care, ensuring that any recurrences are detected in a timely fashion, and also the health economics of this new model of care. We're currently recruiting in a number of sites, some of which you'll recognise: Fremantle, Royal Perth, both urology and radiation oncology, as I said, Fremantle Urology Clinic. And also this is Bendigo Hospital in Victoria and Sunshine Hospital in Melbourne. And recruitment is underway in all sites. Part of the reason for bringing it up this evening is it's quite possible that if you have a man recently treated for prostate cancer, that we will be aiming to recruit them into the study, and assuming they are interested, then we will be approaching you as well. So if the patient consents, we then seek general practice, their GP's consent to participate in the trial. Essentially what would be involved if they ended up in the shared care arm, that you would receive the care plan and information about their follow-up procedure and reminders about their follow-up visits, as I said, with further information about managing their care. And they would essentially have 3 visits over a year for which you would be able to both bill them, but there's also additional reimbursement through the trial for your involvement in the study. So essentially, if you do get a letter from Juanita or myself about a patient in your trial, please say yes.